The question is, if you remove an eye from the eye socket, will it still work for biometric iris or retinal scanning? Let's go back to 1993 and ask Demolition Man for the answer. So let's take a look at this scene. All right, so Wesley Snipes, Simon Phoenix, has killed all the other guards. He grabs the prison doctor, and he knows exactly how he needs to break out of prison. We don't actually get to see him do it, but boop, there it is. You see a little image of the retina turned sideways, actually, and he's out of prison. Shows that. And honestly, I mean, wouldn't you want Wesley Snipes to be out of prison in this movie? He's gonna be just kicking ass everywhere around him, and that's overall a good thing in the context of this movie. Now let's try to figure out though if you could actually recreate this scene in some grisly, futuristic, traumatic, horrible scene. So basically, I'm an occupational plastic surgeon. My name is Dr. Kian Eftekhari, and occasionally, for reasons like cancer or traumatic injuries or other things, we do have to actually remove an eye. So let's take a look at our model to kind of figure out how we do that. So taking off the side of the face with a little magnet here, you could see that the eye sits in the eye socket and it's sort of surrounded by muscles, fat, and then if I take those off with the magnet, there's a nerve that runs back and that carries information from the eyeball to the brain. So when you're, in theory, removing an eye, what we have to do is we actually have to remove these muscles off of its surface and take away the blood vessels that are feeding into the eye and remove that nerve that actually takes information from the eye, the light that comes in, takes it back to the brain, gives you an image so that you can experience vision. So when we do that procedure, it is possible actually to remove the eye and have it be an intact globe, meaning it still looks kind of pressurized. Now, the one quibble I would have among a few with this scene is that if you stick a metallic pen into the structure, it will not keep its shape. So basically the eye is filled with a fluid-like, jelly-like substance called vitreous. And if the wall of the eye gets violated, that substance is going to drain out and there is going to be shriveling of the eye. So it's actually kind of accurate the way they're showing it here because you can see those little insertions of the muscles. There's a lot of blood right around the eye. It's a very grisly scene, but if you're into action movies, it's also very memorable. And when we take those muscles off the eye, you can see those little stumps like they have shown here. The problem is though, is that if you put anything into the eye, you're going to have shriveling effects. So that would definitely lead to a problem with the retinal scanner as he's trying to escape prison. Second thing is we've cut off all the blood supply to the eye. And as you can see here again in that image that they kind of have a little picture of the retina. It's actually turned sideways 90 degrees for unknown reasons. But you know, a normal picture of the back of an eye of the retina shows the optic nerve in the center. That's the part that we showed you earlier, which connects the eyeball to the brain that carries that information. And then it has blood vessels branching out of it. And those blood vessels have blood flow in them. And there's a nice orange, pinkish hue to the back of the wall of the eye because it has good blood supply. If you take away that blood supply, there's no way you're going to have that picture of the back of the eye. So if it was a retinal scanner in the movie, probably wouldn't work. The other option is it could be an iris scanner. So the iris is the colored part of the eye. It sits inside your eye and it actually gets smaller and bigger depending on the amount of light around you. And so if the iris scanner in this movie, as you can see, it kind of shines a light at the eyeball as he's holding it up, it should have caused the iris to contract, meaning it would get smaller. And then that's part of how iris identification systems can test the person that they're saying. So these are actually used in certain security situations like the FBI and CIA. And in an eye that's been removed, that iris would not move because it doesn't have any blood supply to it. So even though Demolition Man was correct in predicting that iris and retinal scanners would be used in future decades, it did not exactly depict this situation accurately. And I don't think Simon Phoenix would actually have been able to escape prison the way the scene was depicted. Sadly, Demolition Man also did not predict correctly that Taco Bell would be the only restaurant that you could go to, which my wife is a huge Taco Bell fan, and so that would have been a future that she would have been totally up for. If you like this video, feel free to subscribe to our channel or to comment below or tell us what other videos you'd like to see. We'll keep breaking down some of these movie scenes from Hollywood to tell you, is this real or is this not in the future?